All right, our topic for this project is going to be pulmonary stenosis. Pulmonary stenosis pathophysiology. Pulmonary stenosis is characterized by the narrowing of one point, or several, from the right ventricle to the pulmonary artery. The tricuspid and bicuspid valves may be normal or they may be dysplastic. The narrowing of the valve or blood vessel causes resistance to blood flow at the right ventricular outflow tract, which in turn increases pressure in the right ventricle, leading to right ventricular hypertrophy. Disease process for pulmonary stenosis. When the disease is critically severe, pulmonary artery obstruction elevates the right ventricular pressure severely, causing blood to regurgitate into the right atrium. The pressure in the right atrium rises, forcing the foramen ovale open, which allows the blood to flow from the right atrium to the right ventricle, eventually resulting in heart failure and death. Progression and prognosis. A major complication of this disease is heart failure. It should be monitored for and classified accordingly. Treatments include the following. Medications can be given. Loop, thiazide, potassium-sparing diuretics, as well as afterload reducing agents like ACE inhibitors, angiotensin receptor blockers, beta blockers, calcium channel blockers, vasodilators, as well as digoxin may also be given. Anticoagulants may also be used in severe cases of ventricular dysfunction. A more aggressive treatment for severe patients may include catheterization or surgical management. We got an NCLEX question. The nurse is aware that with pulmonary stenosis, resistance to blood flow at the right ventricular outflow tract occurs due to A. Increased blood pressure, B. Decreases in heart contractility, C. Narrowing at the valve or blood vessel, D. Narrowing at the peripheral blood vessel. Alright, the answer is C, narrowing at the valve. We got another NCLEX question. Percutaneous balloon valvuloplasty is when a catheter is inserted and advanced to the heart. The nurse knows that this treatment occurs in cases that are more severe. Which is the insertion point? A. Aorta, B. Femoral artery, C. Subclavian artery, D. Brachial artery. The answer is B. Femoral artery. And this is just a list of references we use for this PowerPoint presentation.